Magandang hapon. Annyeonghaseyo. Good afternoon to all of you. Welcome to the UP-KRC Public Lecture. This online event is organized by the University of the Philippines Korea Research Center in partnership with the Korea Center for United Nations Human Rights Policy. I am Ador Torneo from De La Salle University, Manila, and I will be your moderator for today's event. We are delighted to welcome all of you, our participants who are joining with us in the safety of your homes through the UP-KRC's YouTube channel. Before we begin our program this afternoon, we would like to remind our audience on some house rules. You may send questions and comments throughout the presentations and discussions in the YouTube chat room. The questions will then be collected and answered by our speaker during the open forum. At this point, please allow me to provide a brief background of the organizers of today's program. The UP Korea Research Center, or UP-KRC, was launched in April 2016 to provide Filipino scholars and researchers with opportunities to widen their interest in Korean studies. The center conducts various academic and cultural activities for scholars and professionals and serves as a university-wide hub that promotes and develops Korean studies in the Philippines. For more information and updates on the UP-KRC, you may visit their Facebook page at www.facebook.com/UPKRC. Today's session is interactive as audience can leave questions or comments via Facebook and YouTube Live. If you wish to ask our speaker any questions later, please feel free to leave them. So I will now go to the introduction of our esteemed speaker. This afternoon, we are privileged to have our distinguished speaker, Dr. Changrok Soh. Dr. Changrok Soh is a professor at the Graduate School of International Studies, Korea University. On September 17, 2020, Dr. Soh gained membership in the United Nations Human Rights Committee, or UNHRC, with a 4-year term. According to the UN in the Republic of Korea, this is the first time a Korean gained membership to the committee after 1990, when Korea signed the Code of Rights at the UNHRC. Dr. Soh has also worked in Human Asia, which is an organization addressing regional human rights concerns for East Asia, according to East Asia Young Activist Networking Program. And this afternoon, deliver his talk entitled The Impact of COVID-19 on Human Rights. Let us all welcome Dr. Changrok Soh. Dr. Soh, whenever you're ready.
Thank you very much. Thank you very much for a good introduction. First of all, I'd like to thank the Professor Baek Young-min and all the staffs for inviting me. It's a great honor for me to speak today. I think this is the YouTube and the Facebook, the live streams on. So my phone is ringing. I'm sorry. I think most audience are from the Philippines, but basically everybody in the world are able to watch this. So it's really good. Now I'm thinking about the Philippines. I've been to Philippines. Last time I went there is 1982. It was already 40 years ago. It's a shame on me. I've never been to Philippines since then. But as a matter of fact, the Human Asia, which is a human rights NGO, Professor just introduced, that I established in 2006. It's already 15 years old. And we started a new project in the Philippines 2 years ago, just before the pandemic. And we are helping the minority group called Mangyan peoples in the small island called Mandoro, island of Mandoro. So I planned to visit that place last year, but because of the pandemic, I wasn't able to visit the place, but sooner or later, I wish to visit the place. And also, the Human Asia has done a lot of education, human rights education work in Southeast Asia. But unfortunately, I didn't have much chance to communicate with the people in the Philippines. I wish I can do more after pandemic is over. No, I wrote a book 2 months ago, and actually I was confirmed COVID-19, last year in March last year, and I had all kinds of the bad experiences because of my the illness. I was hospitalized, isolated, and I was really sick, first of all, and I was a fear of death. And during the whole process, I felt that I was marginalized, stigmatized, and discriminated, and I think I became a victim of this pandemic. So thinking of all those thinking and experiences, I decided to write a book. Then the book actually became very popular in Korea. And it's got a lot of attentions. I had a lot of interviews from the newspapers. And no, I think this is one of the reasons why I was invited today. Many patients are suffering from similar experiences, but many of them are not able to speak out because they are worried about the consequences. Just being a patient sometimes problematic in many society. But as a professor and UN expert, I'm lucky that I can say publicly, and I think it is important to record my experience. And this is written in Korean, but I'm planning to translate it into English so that more people can read. But before translation, it's a great opportunity to speak with you. So I will share my screen. Okay. All right. So process slow. Okay, I think you can see this. So title is Impact of the COVID-19 on Human Rights. But I'd like to speak first of all, the relationship between the pandemic and human rights, particularly with the case of Korea. Because when I'm from Korea, I have experiences in Korea, and people tend to disregard the importance of in terms of impact of pandemic on human rights. And most of all, I like to speak about this. And then second topic, if I have time, I want to say about is the new and emerging digital technologies and human rights. This topic is my research topic for last 5 years. I've been doing a lot of research, and also I brought this issue to the United Nations. And as a member of Human Rights Council Advisory Committee, I have done my report last for 3 years. Then the report will be submitted in June this year. So it is soon to be published officially. So it has not been official yet. But the thing is that I think the United Nations and all the global society should be prepared to respond to the new challenges of digital technologies. And then facing this pandemic issue, I think the future that I was thinking about came faster. If you think of what's happening with this pandemic, of course, there are a lot of patients and there are many difficulties. But as a matter of fact, we are able to contain this virus because of the new technologies, digital technologies. Without the digital technologies, we were not able to have this kind of education programs. We're not able to trace the patients. So in another sense, we have saved a lot of lives thanks to the digital technologies. On the other hand, there are a lot of human rights violations coming from the using the digital technologies. We talk about the privacy infringement and infringement on personal information are all due to the digital technologies. So I think it is important to the human rights implications of the digital technologies. And the very important lesson is coming from this COVID-19 pandemic. So ironically, even if we are suffering from the difficulties due to this coronavirus, other side of it is a great opportunity for all of us to prepare for the future, because I think we will face very serious the human rights threats in coming years. So briefly, I'd like to mention about it and what is my report about it, and that is also related to the issue of future of human rights. Okay, so I think we have 1 hour until 2 o'clock in the Philippine time, and probably I'll give you 30 minutes a lecture, then I'll have some Q&A session. The Korea, I don't know how much you know about Korean case. Korea is known as a very successful country in terms of the containing virus. With the government, the quarantine system, many Korean government officials are proud of so-called K-quarantine system. It's 3T is emphasized here. 3T means trace and test and treatment. So Korea was able to trace the virus and test a lot of people because we had developed the test kit and also the good treatment for the patients. Now, all those were possible actually because of the advancement in digital technologies in South Korea, and also the good medical systems, and also the advanced how can I say, the people's the civilian status. So all three was a big contribution to the Korean the quarantine system. But it is not to say that the quarantine, the mechanism has been perfect, because we still have the many patients, where it's a lot less than many other countries. I just heard that the Philippines have tens of thousands of patients every day, but recently it came down. But in Korea, we normally have had less than 100 patients, but these days we have 600, 700 cases. But relatively, I think it was very successful. Then the strategy, I think it was a good part of Korean strategy. was three things. First is respect for transparency. The Korean government was pretty transparent in terms of how many patients and what is the status of global society. They opened to everything so that the people can make their own decisions. And open democracy, Korea, as you know, is very well democratized society, and we, relatively had a good way of dealing this pandemic with the democratic principles and based on the rule of law, thanks to that. So maybe Korean democratic system helped Korean quarantine strategy. But on the other hand, the flip side of it is there's a lot of infringement on privacy and data protection, which has been disregarded in this process. So I'd like to, first of all, speak about this aspect. So from my experience, I went to New York last March, 2020 March. I was running for the member of the Human Rights Committee, and I was campaigning, and I visited New York, and the March of the 2020 was just right before the outbreak of COVID-19 in the United States, in New York. Then as soon as I arrived, the virus spread rapidly, and there's a lockdown and everything was closed. So I had to come back to Korea sooner than planned. Then at the time, I was infected by the COVID-19. And as soon as I came back to Korea, I was confirmed positive for the coronavirus. Then immediately I was isolated and hospitalized. So before I went to the hospital, the Korean government started to investigate me. At the time, there were not many patients in Korea. So I was the 19th patient in Seongbuk-gu province. And my personal information was completely revealed. Even newspaper reported the infected case. So the government asked me, obviously they know my phone number, so they can trace my movement with my phone. And also they asked me to give my credit card numbers so that they can check where I used credit card. Then plus they asked me to take my photo, selfie, and send it to them. So I was really surprised. Then I asked them, why do you need my photo? And then they said they will check all the CCTVs to confirm that I was that place or I was lying, etc. So I wasn't able to understand at the time on what ground can they ask me to provide those personal information. But 2015, 6 years ago, Korea was hit by the outbreak of MERS. MERS is the very serious the infectious disease.
Dr. Soh, excuse me, I apologize. Is it possible to share your screen, the slide? It's not shown right now. I'm sorry about that.
What's wrong with that? 1 second.
There.
I'm sorry. Maybe I have to reshare.
Yeah, it's good. Thank you very much.
Okay, now I'm sorry. Okay. Oh, I'm sorry. So you are not able to see my slides so far? Oh, I'm sorry. Okay, so go back here. You can see the photos of cellular phone, credit card, and the photo. So that was what the government asked me to provide. And because of experience of MERS in 2015, Korea was able to enact a new law called the Infectious Disease Control and Protection Act. So according to that law, the Korean government was able to collect personal information and personal data. So I think when they have that law, when they said this kind of law is necessary, obviously they didn't think about these human rights violations issues. So after this pandemic, obviously they will have to change it. And also my personal information was published in the web. So anyone who knows me know that I was infected and I was hospitalized. So some of my friends called me and asked me whether or not I was infected because my information was revealed. So it was a really terrible experience. And then they started rather than ask me my status and worriness stuff, they are worried about they might have infected because of me. Obviously, my families are different, but most other people, in my workplace and all other people are worried about their safety. So suddenly, I became a human rights violator rather than victims, and I started feeling that because I've been helping a lot of minorities. I'm a human rights activist, and I'm working for the minority groups, the refugees and migrant workers, etc. But I felt that I've never been, in their position. I didn't know how they would have felt when they were marginalized and when they were excluded from the society. So positive impact of this COVID-19 on me is I was able to, how can I say, empathize with them, so I could better understand their position. Anyway, I was treated as a person who brought the virus from abroad to Korea and spread virus to other people. So that feeling was really bad. And also I was really sick. At the time, we didn't know the exact mortality rate. So I thought that there are high possibility of dying. So I'm very worried about my health situation in the hospital. Then we didn't know about the virus, much less than what we know right now. So there are a lot of things are crossing my mind. But as a human rights person, I felt a lot about the human rights infringement because of the virus containment policies. Okay, then after I got out of the hospital, a lot of people ask me, because they know I was hospitalized and I'm a human rights activist, ask me about human rights questions. And obviously, European Union was very interested in my experience. So I talked to many people in EU and EU Commission in Korea, and I had several public lectures with my experience. Then I realized that the Korean citizens, even if Korea was highly democratized, they have very less concerns about the privacy invasion issues. And the Europeans started asking me, the problems of a Korean quarantine system because it is violating the individual freedoms. But the Korean experience is actually different from what Europeans are thinking about. Because Europeans think that because Korean authoritarian characters, Korean government is able to, limit their personal freedoms using these measures. But that is not exactly the case. Korea is very much democratized. It's very open and transparent. So it is different from authoritarianism. But Korean culture is different. Okay, so I thought that European citizens have a long history of democratization. They have fought to earn individual freedoms from the surveillance of states and state controls and state authority for many, many hundred years. But on the other hand, Korean democratization process happened in a very relatively short span of time. Okay? And Korean protests were mainly against individual military dictators rather than the state surveillance or state power itself. So it's just because of different cultures. But this is not to say that Korea is better than European society. Korea was successful because of the tradition. So basically, we can say that Korean people have trust to the government in a good way. But on the other hand, because of it, we tend to disregard the individual freedoms infringement. Okay. So in fact, there are a lot of criticisms against the Korean government, even if the Korean governments are boasting their successes, but still the other side of it, there are a lot of critical group of people who criticize Korean government's the policies. But looking back, the Korea never closed the boundaries. They always open to the foreigners. As you remember, many countries closed the door, particularly to the Chinese, but Korea never done it. And Korea never had a lockdown policies. We never restricted the movement of people. And except a short period of time, mostly Korean stores, restaurants and the stores have been open, even if there was the time restrictions. Still now, the restaurants open until 10 o'clock in the evening. So it is a very open way, but on the other hand, we were able to contain the spread of virus. That was possible because of the trust to the government and also new technologies, use of the proper new technologies. Okay. Then a few cases that we almost violated severely human rights. The first case was the electronic bracelet. When I was in the hospital, actually, in April, I guess, last year, and Korean government announced a policy to put the electronic bracelet for citizens who are self-quarantining. Okay, if you had close to the patient, Korean citizens are supposed to have a 2 weeks self-quarantine. And also all the foreigners coming to Korea should spend 2 weeks in quarantine. And government had a policy to put the electronic bracelet to all those people. I was really shocked with that policy because I thought it was severe the infringement of the individual freedom. But majority of Korean citizens, I remember almost 80% of Korean citizens were agreed to that policy. But nonetheless, the National Human Rights Commission announced the negative view about this policy, So now the Korean government have policy to put electronic bracelet to only those who violated the self-quarantine. Then they put this bracelet so that they can control the movement. But anyway, this is one case. Then I think I heard from Professor Bae before this lecture that the Philippines also adopting this policy, the print QR code entry log. So wherever you go, to the restaurant, your store, you have to put your personal QR code when you enter the store, so that they can have the record where you're moving around. Well, this is maybe necessary because when there's the outbreak of the virus in certain place, we have to know where those who were in the same place, so that they can get tested. But we have to think about what is the consequences of using this data. Everybody using. No, advantage for Korea, actually, everybody has smartphones, and everybody have access to the internet, and everybody has the tablet or the personal PC. So it's a great advantage for Korea relative to the less developed countries. But anyway, everybody give their personal information to government, and meaning that government have all the information about their citizens, and trusting the government is a good thing on one hand, but on the other hand, there's a lot of possibilities that government can misuse the information. And also, when the data transferred to other people, then there are high possibility that those data can be misused. So we have to be aware of the negative consequences of the collecting data and transferring data. I think it's very important in the future society. Okay, another case that I was really shocked. This is also why I was in the hospital. What time is it? Okay. In Itaewon in Seoul, where a lot of clubs and the young people are moving around, and there's one Itaewon nightclub. There was outbreak of COVID-19 in last May in 2020, and that nightclub is known for the sexual minorities, and government asked all those people who were in the nightclub to get tested, but many of them, because of their sexual identity, they didn't come out. So, let's say there were 300 people in the nightclub, but only several people got tested. So what the city of Seoul did is ask 3 major telecom companies to provide the information about the people who were in Itaewon at that time. So hundreds of millions of people's information went to the city of Seoul. Okay? Those who were in Itaewon at that time, and those who passed by driving a car, everybody who were near Itaewon, got the information transferred to the government, city of Seoul. This I was never understand this situation. There was no resistance from Korea citizens, but this is really dangerous, because this information is not just information about their names and phone numbers, but when they transfer this data to city of Seoul, your data about your preference, your shopping styles, what you're eating, everything about you are contained in personal data. And that is transferred to the city of Seoul without any social agreement. No, it's really, well, on one hand, it's good for the city of Seoul to contain the virus spread. But on the other hand, we are not seriously thinking about the personal information's importance. Okay, so all I said about right now is importance of the protecting data. But as a matter of fact, if you think of the importance of the public health goals, okay, sometimes we have to restrict personal freedom. That's for sure. Right? You look at the United States and look at what some of the European states, they are emphasizing the importance of personal information and privacy. So they don't even wear the masks, and they never able to trace the patients. So we have seen a lot of patients and a lot of damage in terms of public health goals. So that's the problem for the Western society. I'm not saying that the Korean type of the strict the measures are not always bad, but we have to understand the importance of it. So there's a conflict, tension between public health goals and right to privacy and freedom. And to what extent can we restrict personal information, personal individual freedoms in order to provide public health? That's the endless question. When I wrote this book, no, my book is not about criticizing the Korean government. This book is not about supporting Korean government. This book is about the COVID-19 patient. This is essay and diary of a patient. So I just objectively are talking about. But after I published this book, many people trying to interview me in interviews. So some people emphasize only the privacy infringement. So use my book as a book to criticize Korean government, and some of people are staying in the other the position. So my position is not like that. So the question is, how do you relieve the tension between public health goals and right to privacy and freedom? This is a really important question we all have to answer in this pandemic, also after pandemic, also for the future of our global society. Okay, so let's go back to my book. The title of my book is "I Was Infected: Hospital Diary of the COVID-19 Patient." Actually, the Professor Bear had a better translation. I was infected, UN Human Rights Committee members' record on being confirmed with the coronavirus. Okay, whatever it is, this is my book written in Korean now. So I say this is about the missing humanity in COVID-19 or in New Age. So human rights is all about humanity. It is not about individual privacy. It is not about the health. I mean, it includes all those importance, but it comes down to the humanity. Okay. So number 3, I said new thoughts on human rights. I've been spending 25 years thinking about human rights and activities of human rights, but I have realized a new understanding of human rights. Now, as a guy who spent my life on human rights, because of my experience in the hospital and the illness, I realized the important meaning of human rights. Okay, what is this? My life turned upside down. I felt new things because of this experience. Okay, so I think a lot of a lot in the hospital. Okay, then basically, human beings have both individualism and communitarianism. Okay, we need both. Okay? We need both freedom and equality, right? And we need both individualism and communitarianism, meaning that each individual are very selfish on one hand, individualistic, but on the other hand, they are concerned with their community. They are communitarian. Okay? But often cases, people, even those who study human rights, are confined in a particular position. So if you see the human rights from individualistic point of view, you focus on individual freedom or privacy and personal information, etc. And if you pay too much attention on communitarianism, then you tend to disregard the importance of personal information and focus on safety or security of the community. Okay? This is the endless debate, but problem is they do not communicate each other more and more. Even in South Korea, even if we are so much democratized, now the division between the conservatives and progressives are widening, and they do not communicate each other because they are stick to their ideologies. The world we are facing in the future, so-called the digital transformation or digital era, we need to be more flexible. We have to learn a lot of lessons in this pandemic because this pandemic teaches us to get rid of that tension. That is important for the future of human rights. So in the last sentence of my book, I say, what I have realized in this experience is that real freedom comes when you are caring for others. So freedom, how is the freedom related to the caring for others? Well, basically, I'm talking about individualism and communitarianism. So new balance between individualism and communitarianism are needed. If you don't realize it, if you don't make institutions thinking about this one, individually you are not happy, and institutionally you're not going to make a proper society. Okay, and also globally. Okay. So let's think about, lastly, the human rights issues in COVID-19 pandemic. First, I said about privacy and data protection. In many countries, actually, not only in Korea, many countries, particularly government, they exercise their power with the name of the quarantine. They violate privacy and data protection. And there's a lot of discrimination, hate crimes. We've seen a lot of the hate crimes against Asians in the United States and all over the world. Okay. Everybody is difficult in this pandemic, and people tend to blame others. Okay. So this kind of discrimination, increasing, then exclusion and stigmatization. Just like I have experienced, people tend to put a stigma against the patients. Okay. Actually, in history, we have experienced this many kinds of the stigmatization. Okay. And many patients who survived from MERS in 2015 in Korea, I have a report that saying the more than 50% of the survivors are suffering the mental disease at this time. So with a lot of patients with the COVID-19 also experiencing similar the disease, but obviously they are unwilling to talk about it. And also we have to think about marginalized groups. They are more difficult than the others. And obviously inequality, the digital divide is widening, and poor and riches, the gap is widening. In terms of education, everybody is suffering from lack of education, but poor people have the worst situation. And I think the gap between the educated and uneducated will be widening after pandemic. So without caring for their positions, we're not going to sustain healthy society domestically and also globally. Okay? And we have to seriously think about the mental health. Okay? Even now, I guess, because of isolation, because of a long delay of their work, because of containment, all those reasons, many people are suffering from the mental disease. But because even in South Korea, there are a lot of negative perceptions toward the mental disease. They are not talking about, and they are not going to hospital for this disease. So this is going to be a very important issue. And lastly, we have the problems of fake news, disinformation, and misinformation, and and this is also not only for this pandemic, but for the future. Because of digital technologies, it's much easier to make fake news and provide the disinformation, misinformation. So this is a very important issue. But from human rights perspective, to banning the criminalizing those who make fake news are not good policy at all, because everybody has a freedom of speech, everybody have a freedom of thoughts. No, it is not solution to prohibit the making fake news. Okay? The fake news become problem when those news hurt individual dignity, human dignity. Okay, so in that case, even the real news. When you reveal the personal information, then it can have a huge damage. So, fake news or the real news is not a big deal, actually. But sometimes you don't know which one is a fake and which one is real. Now, who is going to make a decision whether or not it's real? Okay? If government do it, if government lies, then those who are speaking the reality will be sacrificed. So, we have to be very careful. In this pandemic, many governments are making actually fake news for themselves and hurting the civilians. So empathy is the word that I like to emphasize. Freedom with empathy is a key word for the future. I don't think I have time to speak more about the new technology stuff. Probably, if you allow me, I'll have another session to speak about my report and importance of new technologies for the future of human rights. But today, maybe last one more page. Spanish flu. Think about Spanish flu. Spanish flu. It lasted from 1918 to 1920, 100 years ago. There were 500 million cases, 1/3 of world population at that time. So it has a huge impact on global society. And estimated 20 or 50 million people died because of this flu. And comparing with the COVID-19, we are experiencing right now 160 million cases, and only 3.36 million died. Compared to the Spanish flu, damage is much lower. No, it's because many technologies. But funny thing is, I like to emphasize is that we learn a lot about World War, First World War in the history, but we don't know there's the text, much history text about Spanish flu. Even it was the deadliest pandemic in human history. Why? Because historians believe that world wars were human-made. So it is because there's the sacrifice because of human beings. We should have prevented this war. But Spanish flu was considered as natural disaster. Okay? So we don't much talk in the history. But COVID-19 is completely different. 50 years later, 100 years later, in the history, COVID-19 will be really, really important text in history book. Why? Because we think we could have prevented spread of virus much better using the digital technologies. And also, we have seen a lot of human rights violations because of digital technologies. So I think, as many people say, the 21st century actually started 2020 rather than 2001 because of this incident. So we have to learn a lot from the COVID-19 experience for the future society. I will stop here. I spent too much time. I will get questions now. Thank you very much.
All right. Thank you very much. Thank you very much, Dr. Soh, for the insightful and comprehensive presentation. As a scholar involved in studying and coming up with solutions for many of the challenges arising from the COVID pandemic, I especially found relevant your discussion on the human rights aspect of the pandemic that is often forgotten. And I was also especially interested in your own sharing of your own experiences and reflections with this pandemic. It was a very personal reflection. And I think to an extent, it helps remind us that addressing the pandemic does not need to come at the expense of human rights. But also you present some other different perspectives. You mentioned about flexibility, in some sense, and some other insights. But I think at this point in time, I'm going to read the questions from our audience that we have collected. So, okay, the first question that I have here is this. This is about mental health. Our mental health is significantly affected by how human rights are being upheld in our community. Do you think that the existing laws and policies are effective in addressing issues on vulnerability and does not undermine mental health?
Well, in terms of laws and policies, every countries have different approaches to this pandemic because of different political institutions and different cultures. So I think the very thorough evaluation in terms of human rights will have to be done after this pandemic over. But in generally, most countries, excluding the Western countries, are too much concerned with the containing virus, controlling the people. They are not protecting the individual, the freedoms. Okay, and also at the same time, they don't have enough space to consider the mental disease and people's isolation and the stigmatization, etc. So those are really important because after this pandemic over, so the after effect, the side effect of this pandemic will stay very long time. Okay, those who suffered from this mental disease and those who are not educated at this time, those who became much poorer at this time, how are we going to deal with this? So in the future, the similar things will come to us. So we have to be ready for the future. Okay.
Thank you very much, Dr. Soh. I will now read the second question. How does an administration or how does a government ensure that frontliners and medical workers are well compensated and well protected during this pandemic?
Mm-hmm. Well, it also depends on the different situations of different countries. In fact, I have one chapter in this matter in my book. because the frontliners and doctors and nurses were really hard time. They are sacrificing themselves, but they are not enough compensated for their work, and there are a lot of blames to the doctors and nurses. I think when the Korean society is like that, many other societies will be the same. Okay, and then this is also why we need the empathy. Because everybody is in difficult situations, they are not concerned with the difficulties that others are experiencing. But obviously, the frontliners is most damaged people. Okay, thank you very much.
Thank you very much, Dr. Soh. I will now read the next question. Given the dire need to curtail COVID cases through the vaccines, is it considered a human rights violation when people who are referred to as anti-vaxxers, these are people who are against vaccination, are forced to be inoculated?
Well, this is a really difficult issue. I missed in my lecture to talk about this one because in Korea, even if I think and many people consider that Korean K quarantine was very successful, but Korea failed in acquiring enough vaccines in Korea. So now the Korean government are facing a lot of criticism because of lack of the vaccines. But anyway, vaccinated, whether or not we have to be vaccinated or government should require the vaccine to everybody. Well, in my view, it's a personal decision. So we have to provide correct informations. The transparency is very important. We have to provide what is the side effects of vaccine, what is good about it, what is the positive contributions of vaccine. Then listening to all those, the real stories, the decision will have to be made by individuals. But I guess most individuals, if they have not fake news, real news about this vaccine, most of them will be vaccinated. Okay, that's as far as vaccine is provided and available for them, they should be vaccinated. That's my personal view, but ultimately, decision should be made based on the personal decision.
All right. Thank you very much. I will now read the next question. The question is, was there a landmark human rights case that Korea has experienced during MERS or previous outbreaks? And was it considered when Korea came up with the Infectious Disease Control and Prevention Act?
Mhm. Well, Infectious Disease Control and Prevention Act was established in 2015, as I said, when MERS hit Korea, and many people are very proud of that act because it saved a lot of the people in Korea. That's for true. But as I have experienced, there are a lot of negative the consequences. So when they enacted the law, they have not considered the human rights consequences. So this law has to be revised in Korea, absolutely. And when they revise it, they have to carefully consider the human rights implications. Not only the law, but all kinds of the policies. I mean, the quarantine policies, measures. We need the human rights, the assessment. Okay, thank you very much.
Thank you very much, Dr. Soh. I have a personal question, and I hope you don't mind. And this is related to your observation that in the case of the Korean case, Korean citizens have expressed less concerns in regard to privacy and other, personal information issues, unlike those that you said in European countries, where citizens are more concerned about this and have expressed more concerns about these issues especially with their government. As an observer, I cannot help but think that there might be social and cultural dimensions in addition to the element of public trust at play. I mean, you said that many Koreans trust the government, and that's why possibly less concerns. And on the other hand, Westerners had been less receptive about government pandemic measures such as contact tracing, wearing of masks, constraints in mobility, and really a lot of concern with preserving their individuals' freedom and liberties. And on the other hand, in Asia, in South Korea, most, at least our observation is that many Asian countries, people had been generally more tolerant in of these measures. In this case, do you think, is it reasonable to say that giving up of individual freedoms and liberties in the name of protecting public health is really a matter that's up to the respective societies to decide or negotiate with their governments rather than a universal imperative?
Okay, that's a good question. That's actually the main point of my book, if people understand correctly. But no, I just explain very carefully. Obviously, Korea, because of culture or because of tradition or social institutions or whatever you call, obviously we have more communitarian values, more than the Westerners. Well, this is a good aspect actually, on one hand, but because of that, they are disrespecting the importance of the personal and protecting personal information and privacy. The negative consequences will come around in the future. Okay, that's what I mean. I didn't have time to speak about the impact of new technologies on human rights. But properly dealing with the data is really, really important. We have to see the negative impact arising from the misdealing of the data. So how do you know? How can you trust government? Government can always properly use the data. And even if government intend to use properly, there's unintended consequences of using data. Okay, so we carefully consider this case. That's what I'm saying to Korean society. But in general, in terms of the uh, containing the virus, trust toward the government and helping the government measures is really positive aspect in terms of right to health and right to life, etc. So there's good things and bad things. Okay,
Okay.
that's what I'm
Okay,
saying.
thank you very much, Dr. Soh. I will read this question from our audience. What are some concerning human rights violation development that you see nowadays in connection with COVID-19? Are you looking at any particular country or incident these days?
Well, the human rights violations have been, I talked to you about the privacy issue, then discrimination, hatred, marginalized and stigmatization. But in terms of particular country, I'm concerned is the mostly less developed countries. So because we pay attention to the advanced countries, United States, Japan, the Germany, Norway. We don't pay much attention to the less developed part of the world. They are more suffering from this disease. And if you look at India, for example, look at the African countries, they don't even have test kits. They don't know how many people. It's difficult to do that. And as I said, the gap between the riches and poor will be widening. Okay. We talk about now the difference between North and South is a big problem. But after the pandemic, and also in new digital technologies era, the gap is amazingly widening. I think end of this year or next year, the U.S. economy is rapidly recovering, and they will have a lot of rapid rise of economy. But what is going to happen to underdeveloped part of the world? Okay, their situations are getting worse. This empathy issue is also applies here. if we not considering them, our future is very dark. The vaccine nationalism is the same. Every country is criticizing the government. In case of Korea, not enough acquiring the vaccines. But let's say that more than 50% of countries don't have any vaccine now. We have to share with them. But now, if you ask Korean people to cut half of them, to provide vaccines to other countries, Korean people will be very angry. So that's the problem of the global society. But this is a challenge. We have to work together for this coexistence. Okay.
Okay. Thank you very much, Dr. So. I have this question. It's a personal question of mine. When we are talking about the different tensions, different concerns about the different rights, do you think that in the name of protecting public health, is there a human right that cannot absolutely be sacrificed or negotiated, even in the name of protecting public health?
Can you tell me again? I just missed it.
Yes. Is there a human right that cannot absolutely be sacrificed or negotiated, even in the name of protecting public health?
Basically the balance between the public health and the individual rights. There's no perfect answer in human rights questions, always, because we are trying to get completely opposite values at the same time. Freedom and equality. Everybody says every human beings are free and equal, but in reality, human beings are not free and not equal. It's impossible. We which is more important. We cannot say which is more important. Okay. So when you establish certain institutions, we have to to make a harmony or balance between two. So now, personally, I think all kinds of institutions right now are in fact too much toward individualism. Okay, we have to in the future world, we have to bring up more communitarian ideologies into our the institutions. That's my actually the argument and hypothesis in dealing with the new technologies' impact on human rights. Okay.
Thank you very much, Dr. So. I have a question here from one of our audience. The question is, what are your observations with regards to human rights situation of the foreigners in Korea during this health crisis?
Yeah, I'm very critical of the Korean government measures on this part, actually, because a month ago, the city of Seoul announced a policy that they will test all the foreign workers residing in the city of Seoul. That's a really discriminatory policy. I couldn't understand how the city of Seoul will do it, because even in my university, there are a lot of foreign faculties. Okay, they will have to be, they are required to get tested because they are foreigners. Okay, that means even in Korean, democratized society, there is a discrimination against foreigners. Not only for foreign workers, foreign workers in the factory, but all the foreigners, they are very insensitive to the issue of the. They don't. So I'm critical of it. In generally, Korea is not concerned with the rights of the foreigners. That's sure. So that's something I'm working on for Korean society. Yes.
All right. Thank you very much, Dr. So. Maybe I'll just read the last question here from one of our audience. Do you believe in the efficacy of the vaccines, Dr. So?
Yeah. Well, I made a reservation for the vaccination in June 11th. So I studied a lot about the vaccine because there are a lot of fake news about vaccine around the world. Whether or not it is fake, which is real, no, you have to make your own decision. but informations are available everywhere. Okay, positive news and negative news. So you have to make your decision. But from my analysis, from my the hearing from others, experts, I think it is not 100% safe. But there is a risk all the time. There's a risk by not taking vaccines, and there's a risk by taking vaccines. But in my observation, the risk by taking vaccines is much lower than risk by not taking vaccines. So that's what I think. Even though I was infected last year, so in a sense I have some no some I say the I don't have to. Some people say I don't have to take vaccines, but I would decide to take vaccines. Okay.
Thank you very much, Dr. So I think that was the last question. Is there anything else you would like to add? Something that you were not able to emphasize during your lecture that you would like to leave our audience here for today? Dr. So, do you have any additional message, or do you have
Well,
any additional points that you'd like to emphasize before
yeah,
we close our open forum?
yes. I'd like to thank you again for providing this opportunity to share my thoughts with you. And I wish to be in the Philippines very soon. I've not been there for 40 years. Shame on me, as I said. I'd like to visit there. And once my book is translated into English, please read my book. It's much better. You will much better understand what I'm talking about today by reading them. Thank you very much.
Okay, Doctor. So thank you so much for answering these questions and very interesting and very informative lecture. We look forward. Please let us know when your book has been translated so that we can get ourselves a copy. I'm especially interested also because my institute also does work with human rights organizations, and we're also trying to work with government in addressing the challenge of the pandemic. So at this point in time, I would like to thank everyone. Thank you, the Dr. Soh, for your lecture this afternoon, and I would like to thank everyone here who asked all of their questions, who provided their comments in our chat box and sent their message through Facebook and YouTube. And I will, with this point, I would like to conclude our open forum. So here, before we end this lecture of the UPKRC this afternoon, we would like to announce and invite all of you to the next event titled Koreanist Workshop 2021. This is a partnership between the UPKRC and Yonsei University Mire Campus. This will be held on May 31, 2021. That's the end of this month, from 6 to 8 o'clock p.m. Philippine time, and will be live streamed via the UP KRC Facebook and YouTube channel. So on behalf of the organizers, UPKRC, we hope to see you in our lecture in May. For more updates on UPKRC's future events, you may visit the Facebook page of UP Korea Research Center at www.facebook.com/UPKRC and its YouTube channel. With that, we formally conclude this afternoon session. Thank you very much to our organizers. Thank you very much, Dr. So. Thank you very much to all of our audience. Thank you and enjoy the rest of your day. Good afternoon.
Thank you.